The one thing that I liked about this fellowship is that it speaks about HIV and AIDS, but it also goes into like investigating, the issue of HIV and AIDS a bit further, which I feel that we are not getting an opportunity to do as mainstream newspaper journalists.
What interested me is that over the past 10 years, the reporting on HIV/AIDS has not been that great. So I'm here because I want to see what new stories I can tell. We've gone through so many controversies with leaders of states who have gone through denial phases. So I think the challenge for me right now as a young journalist in South Africa is to tell new stories about HIV and AIDS.
I think what fascinated me and what interested me most in HIV/AIDS is not the science and the medical side of it, but the human side and the ripple effects it has on a community and how it affects people in their daily life.
This fellowship is interesting because you get to touch lives during the stories that you will do, and we can explore the epidemic and how it's affecting people. And I just want to do something that will actually make a difference, write stories that actually have an impact on people.
I like the idea that I've got the training and support and the financial resources to go and find an in-depth and untold story.
I'm here to learn a lot more about HIV and AIDS so I can report sensitively and responsibly on the subject.
I just wanted to hone my skills in health reporting and investigations particularly because I want to be a pioneer. I also want to be a leader in the field.
I wanted to break the myth of taboo topics. I wanted to break that myth and have a voice, be the voice for people who are HIV positive.
I want to do like a story around the face of HIV in the country, sort of changing that it's no longer a lower class disease, but it also affects people of different classes and races.
I'm very motivated to work on relationships when you, especially in particular women, when you're living with HIV, how do you navigate that? How do you disclose your status? Is it better to disclose the status, or is it better to just date with people not knowing your status?
One of the issues I really wanted to cover is the issue around medical male circumcision versus traditional circumcision.
I'm very interested in looking at the relationship between mental health and HIV, whether patients and families of people who are HIV infected get adequate counselling or mental health care in South Africa.
So I want to look at healthcare for immigrants that have moved into South Africa. Is it hard? Is it more difficult than the average South African? How do they get help? And what effects does it have? Does it send them back home? Because they come here with this dream of greener pastures, and do they just leave with HIV/AIDS?